Welcome to today's lesson where we're going to talk about how to do some simple drug dosing calculations for patients who are on dialysis. We're going to go over 5 very simple equations that you can use when you're trying to determine the amount of drug to give to a patient on dialysis or with CKD, and when you're trying to determine the interval that the drug should be given. So let's go through the very first equation that you need to know, which I'm sure you've already determined, and that's basically a measurement of your renal function. And there's a number of ways you can do this. You can use the traditional equation, which is known as the Cockcroft-Gault equation. Or you can use a more newer equation, one that's known as the MDRD equation, or what you commonly see in the hospital referred to as EGFR. Now, you don't have to know how to calculate the EGFR or the Cockcroft-Gault renal function because these are now easily available with online calculators. So you just have to determine which one of these you want to use, and go on to a search engine like Google, type in Cockcroft-Gault equation or MDRD equation. You'll get an online calculator that'll ask you some simple questions about the patient and the patient's features like the weight and their age, their gender, their serum albumin, etc., serum creatinine, and you'll get a number for renal function. So you just have to choose one of these two methods to get the renal function. The next equation you want to look at is what's known as loading dose, and we'll do that here. You want to know how much of the drug to give up front, or how much load the patient requires. Now, for a non-CKD patient, the loading dose is simple to get. You just look it up in a book, actually, or look it up in the package insert. But for a CKD or an ESRD patient, things are a little different. And what makes it different is the volume of distribution. The amount of drug that you give to a patient, that you load, will depend on the volume of distribution, which will change depending on the drug's parameters, the drug features, and what's happening to the patient. So a simple way to calculate this is just the loading dose that you want to give is equal to the ideal body weight of the patient. You multiply that by the volume of distribution of the drug in a patient with CKD or ESRD, and multiply that by the concentration of the drug that you want at steady state. So concentration of drug at steady state. So let's look at this a little more closely. You can calculate the ideal body weight by simply using an online calculator. So that's not difficult. You can obtain the volume of distribution for a particular drug at a particular level of CKD looking at the package insert, which you can also get online through any search engine. So all you really need to know or decide is what concentration of drug do you want the patient to have at steady state. You can use your pharmacist who can help you determine what's an appropriate steady state level, or you can use some literature because certain drugs have literature published that tell you what level you need to have in order to reach a particular therapeutic effect. So you plug that into here. You can catch this from the package insert or online. You get this from an online calculator and you'll have yourself the loading dose. Now, the third question you might want to ask is, how much medicine do I give once I've loaded my patient? Or what's my maintenance dose? Now that I've loaded the patient, how much medicine do I give subsequent to my load? And that's also pretty simple to figure out. The first step in figuring this out is what's known as the fractional amount of the drug. So the percent of the loading dose that you're going to administer as a maintenance dose, that's represented by FD. And that's going to equal the half-life of the drug under normal conditions divided by the half-life of the drug in CKD. So the half-life of the drug in normal conditions is easily obtainable. You can get that online as well by just typing in the drug name. And you can also get the half-life of the drug for various levels of renal dysfunction. So you put this together and you're going to get something for FD, which is a fractional of the loading dose. Now that you have the loading dose, you simply multiply your loading dose with what you just obtained, which is your fractional dose. And that's going to give you your maintenance dose. So now you've done three things. You know the degree of renal dysfunction. As a result, you are able to determine the amount of dose to load a patient. You then figured out how much maintenance dose to give. And now you just need one other piece of information. And I'm going to need more room, so I'm going to clear this. And the last piece of information that you're going to need is the interval. How often do you give the maintenance dose? Now, the general rule of thumb is if you don't know or are unable to calculate this, choose the same interval that you'd give to a normal patient, a patient with normal renal function. However, dialysis patients are a little bit unique because they come to the dialysis unit 3 times a week. And what that means is you have 3 opportunities in a week to give them a drug. And you may prefer to give them this drug during their dialysis sessions and avoid giving them the drug on their non-dialysis days. That has a lot of implication. For example, some of these drugs that are administered IV would require a separate venous access to administer on your non-dialysis days. So you'd have a patient with a dialysis access and another vascular access to administer a drug. If you only had one access and you didn't want to give the patient a second access, you could change the interval of drug dosing so that the patient gets the drug only when they're on dialysis. And to do that, you calculate the following way. You just do the new interval, which is what you want. It's going to equal the normal interval, which you already know. This is the normal interval of drug dosing for a regular patient, divided by what you calculated on the previous screen, which is a fraction of the loading dose. So you'll know that some medications are going to have a new interval that's spaced far enough that you can give the drug on dialysis and not have to give the drug during your non-dialysis days. And there are other drugs that will still have a new interval, but that interval is still too short and it's going to require you to give the drug during the non-dialysis days, which is suboptimal and something you want to avoid. So let's just recap what we've learned. We have done renal function. That was the first step. Then we went on to the loading dose. That was the second step. Then we calculated the maintenance dose. And to do that, we had an intermediate mathematical equation. And that was the fraction of the loading dose. That's right here, fraction of the loading dose. And then the last thing we did was calculate a new interval if we so desired. And this is the general gist of how to dose a drug for a patient who has CKD or ESRD. Thank you very much.